You know, I never did take someone like that. My blood work is always good. That's because your problem is in the lymph system. See what I'm talking about? But I'd like to see your blood work maybe, honey. A little something close. X-ray's good. So I'm just crazy. Well, you can't see acids in blood work. I mean, in X-rays, that's for sure. Until the mass is so hard that it gives you enough solidification to bounce those rays back to them. I did have a positive ANA, but that led nowhere. Finally, after breaking down on the orthopedic doctor over my spine pain, he did MRIs. The result from my brain MRI said different differential diagnosis, demyelinating disease and microvascular disease. Well, you know, the average person can say that, to be honest with you. The average person can say both of these things. You're losing your neurotransmitters, you're losing your myelin sheaths. That's all, you know, all part of being highly acidic, especially not moving out of the head area and the sinuses like you should. So you're going back to the colon, you're going to work on your GI tract, you're going to hit the kidneys and adrenals to start moving your lymph and get your brain to drain. If you get into a real good cold and flu-like symptom, God bless and honk on with it. Really need to drain the brain, literally speaking, lymphatically. You really start moving these acids out of there. And picking up brain function, cell function, and then that'll rebuild. The myelin sheaths will rebuild, everybody will rebuild, and you'll be okay there. The results from my brain, let me see, the ortho said I had teeny strokes in my brain and sent me to neuro, who said maybe I have MS and wants to do a spinal tap. Well, you know, when you start hurting the body more, it just doesn't make sense. This already tells the story for you. You don't need to have full-fledged brain lesions and everything else. You just know your lymph isn't moving and you're breaking down your cells, be it neural, be it whatever. It doesn't matter. And that's what's going on here. And this is all about your lymph system and moving your lymph system, sweetheart. So you really want to take this on here. That's why I like putting up testimonials. And when I feel that it's appropriate and I get more people willing to go up, and by all means we'll plaster the site with them, but we want to be you know, safe. I don't want to do that test, but I feel horrible all the time. I have a terrible acid problem. Well, more than you realize. More than you realize, sweetheart. And it burns my face and my throat. Absolutely, sweetie. You've got to get into your colon and clean that up, get your kidneys up and your adrenals up, and get drained. This is essential. You got to do it. You're probably going to be the one where you're going to have to do some fruit fasts, some grape fasts and stuff, and really open up these doors, because you don't sound like you want to wait around too long. I understand why the urgency here. My upper spine hurts just to touch it at times, man, you poor thing. And my chest and ribs around the sternum are tender and hurt worse than when I eat. Well, you're just so acid and inflamed. You hit it right on the head. So you really got to move this lymph system out of there. Like I said, it's easier said than done, but you've seen the protocols that we recommend. But again, I'd go to stomach and bowel number, whatever you need. I would go to lymphatic 1 capsules three times a day. That'll take after the GI tract. Use the GI broom if you have to. Want to see mucus in the stools. You want to pick up on kidney 1 capsules, kidney 1 liquid. Adrenals, anything adrenals, the endocrine glands, and another liquid lymph node 2, real strong one, and start moving that lymph the best you can, and hope to heck you have a good cold and flu-like symptom, or go find someone that's sick and start hugging on them. Maybe you're lucky that your body will trip itself into a detox. I'd probably candle the ears, 2 or 3 candles per ear, and just try to break some of that loose on you. Sometimes I feel sick when I eat or drink anything. Like the body wants to shut down. Well, it does. It wants to fast, and it can shut down on you. But that's just, you're just burning yourself up. You're frying like a piece of chicken in a pan here. Exhausted, my eyelids feel heavy, like they need to close, but not the same as when I need sleep. Sometimes I have problems swallowing, like it goes to the wrong pipe. Well, I take that new brain and nerve formula we just put out. I think it's better than the old one. Some people swear by the old one, so okay, but I really, either one of them. Get on the brain and nerve formula, kick that up, kick your endocrine glands up, start moving that lymph, and you'll get yourself out of this. But sounds like you really got a lot of stagnant lymph problems. Make sure you're not cold. If you're too cold, you know, the head area, the pituitary can go down here, taking everybody else down with it, so make sure your endos are up. If not, pop some glandulars, I have to say, to get your endos up before you start having more serious problems. I need to cough something up, or like a hard asthma cough. Growing up until my 20s, I was allergic to the cold. Then it went away, but last week my hands were cold and broke out in itchy hives. Yeah, your lymph system's backed up. My guess is you're having a hypo shutdown also of the endocrine glands. Just, suppressing their function a little bit. That would make sense with the head and the pituitary area again. But go after those. There's a thyroid complex. That's got a little thyroid, pituitary, and adrenal in it. See if that's sufficient. Just to perk them up a little bit while you're honking on. Lymph system's clogged up, but I'm having problems eating anything. Well, you're in trouble. That's why I've been saying that this is a systemic problem. Never is in one place. It's in multiple places. That's because the lymph system is everywhere. So you can see what you're up against here. I really don't know how I do it at times. Yeah, I understand. Well, you're a strong woman, Jeannie. And you hang in there and you get focused in the right direction here. This is for you. And you get yourself focused. A lot of watermelons coming through to me. Melons, cool yourself down. Do some berries. Do the grapes, apples, pears, things like that. I wonder sometimes if I have cancer. Don't worry about it. Bad word. Word just means you have damaged cells. Yeah, you have damaged cells. All right, repair them and rebuild them. Don't sit there and take that. Don't let the mind carry you away into the fear world. You get strong, Jeannie. You're going to come out of this and get yourself out of this, okay? I really don't know how I do it. I'm 42. I have two girls, 8 and 23. Well, think about them as well, because they're going to have your genes. And if they have your lymph system, it's just a matter of time. And I work as a cocktail waitress in Las Vegas. My job looks glamorous, but it's it's hard work. I'm aware of that. My sister did that. Very aware of it. Yes, it is hard work. Walking for 8 hours, God. Carrying heavy trays, God. I don't know how you guys do that. I don't. I thought I might have a hernia because I have pain in the sternum xiphoid area, but after endoscopy, he said just a lot of inflammation. Hello. There you go. No GERD, acid, just inflamed. This is because this is just your lymph system sitting there burning on you. You're not moving your lymph system well at all. And you're constantly in activity as a waitress, which I'll be honest with you, you're not going to like this, but that's not what I'd be recommending. I'd be recommending rest, more of a desk job or something for a while, and get out in the sun when you can, because all this activity is just making you worse. And that has been my point all along here, that you'll see when you're not filtering and you're in activity, excessive activity, all this lactic acid and all these acids that you're kicking up and you're not moving out makes you just worse and worse and worse and worse. And so it's a time for everything, just common sense and wisdom. Animals fast when they're sick. They don't go out and tear it up. And that's really what you've got to do, the same type of thing. Your body's telling you to rest, or it's going to shut you down and make you rest. I mean, that's the problem with not listening. And I'm not talking about myself too, so, but that's a butt kicking we can get. And so if you're not careful, your body will put you down and make you rest. So you want to be ahead of your body and try to find some rest. You're not in the best of jobs for your problem. You're always creating a lot of activity with very little filtration of the lymph, and their symptoms bear that out quite readily. So you're a good case to show the YouTube healers here, just that what I'm saying about activity. We have a lot of concepts out there that really don't hold any common sense water when you look at it both from physiology of the adrenals, remember the epinephrines versus the dopamines, and then, of course, with what you see in fasting in animals, that sort of thing. Please, I need something so that I can eat without pain or juice. Well, Jeannie, get with that, honey. Now remember, you can call in here, talk to Jennifer or someone. But definitely, you've got to move lymph. And the trouble is, you're in a very active and demanding job that creates a lot of acid. So you really got to make sure you stay raw. And then you might have a little adrenal bump without the proteins and stuff, because it could make you more tired in a job like this. But with that said, you'd be a case where you don't want to do any protein whatsoever. I'll show you this. Spend you about 3 weeks off of all proteins, even nuts and everything, and then go have some. I think you'll become quite aware, like the pizza guy in the head. Hi, Dr. Morse, referred by Dan McDonald. I am helping my husband in his journey of healing with ulcerative colitis. Oh, back to the colon again. You know, you see so much of this. Of course, you know colon cancer was number one, but you're seeing this all over the place, systemic inflammation or acidosis, and it's all the lymph system again. So the same thing as we talked earlier about Crohn's would be the same thing for your husband there. Same very thing. Sound like a broken record? I hope so, because really, if you get this, then the challenge is your self-discipline to ride the ride. The knowledge part of this is really, I think, essential to help you to put your feet on the right path. But then, by all means, challenge your self-discipline. You're going to be doing it. You're not going to always be perfect. Every once in a while, you're going to have a piece of pizza. All right. You go on and forget it and go on. Enjoy every minute of it and forget it and go on. We used to tell that to each other. Make sure you enjoy that cheat. I never enjoyed a cheat. I always beat myself up for doing it. And, of course, it made the cheat even worse, because I'm really hard on myself if I don't follow through and don't keep with the direction that I'm focused. And then as I got older, younger, I just learned to, not care so much. Matter of fact, if you want the God state, you can't care at all, even about the health of yourself. Amazing, isn't it? To avoid removing his colon, as advised by his gastroenterologist, of course, he has changed his diet, eliminating meat, dairy, fried. That's the best thing your husband has done so far toward this. Good job. Good job. It's been a plant-based diet, vegan diet for about 2 months so far. He has stopped taking all medication and has seen improvement in his stool formation, more form to loose stool formation. However, he struggles with severe urgency, oftentimes resulting in accidents. Well, highly inflamed, highly spastic. And when you're that acidic, and of course you're going to lose calcium, and you're going to see that whole scenario we've been talking about, then you're going to see the spasticity, which is what that is. But you got to keep unwinding this clock. You got to keep unwinding this and get back to a sense of wellness and get the tissue fixed up, even if the urgency is still there. Keep working that out. Prostate does the same thing to urination. Bladder swollen, all these have the same effect in different areas, but it's just getting these restored back to a state of health. And of course, that takes you to what causes the unhealthiness, if you will, of tissue, or the decay of the function of cells, etc., which takes you right back again to the lymph and acids and the broken record.